Traditionally, records were in paper and not electronically. And when they were in paper, they were sitting in a doctor's office or in the record room of a hospital, and were generally not controlled by or available to patients. If a patient wanted a copy of his or her records, they could request it, and that request might get responded to, it might not, and that information was Xerox copies of largely illegible handwritten records. The advent of electronic medical records has both increased the legibility and increased the ability to access them, to the point where now if you want to participate in the federal government's compensation for implementing and using electronic health records and avoiding the penalties that will soon come for not using them, then you have to follow guidelines for meaningful use. And those guidelines include having a patient portal to which patients can access their records. And that already exists. So as a patient, I've got my doctor has a portal and I can access my records through there and look at results of tests and things like that. That's already available. But still, the records are owned by the healthcare providers, whether it's a doctor's office or the hospital. There's this notion called fair information practice. There are principles of fair information practice that say that publicly available information about you, or available information about you, ought to be controlled by you. It includes credit card information, banking information, any information that's out there about you, you ought to have control over who sees it and how it's used. Now, that may be a principle, it's not followed very much. So it is followed. Your bank can't send your information to people, although it can send reports that include your data to people. But healthcare provider organizations will often, healthcare insurers, other people, credit card companies sell your data all the time. I mean, people's data are being bought and sold all the time. So those may be principles that are not often followed. And to date, they're not followed in healthcare. And to be followed, one would have to have control over who could see the information in their electronic health records. Right now, there are a very small number of places that have implemented a way that can happen, but it's generally all or none. That I give you my password into a system so that you can look up my data. And that works okay. It prevents people you don't want seeing information if there's certain people you don't want seeing information in your record, you can prevent that from happening. But for the most part, the information in your record is not sensitive, and most people don't care about it. I mean, things like what's your serum sodium concentration, and how tall are you, and your normal chest X-ray, when you had your last flu shot. That's very important information, and it's boring and not sensitive, and nobody really cares much about it. There are really only certain categories of information that studies have shown that patients care a lot about. And those are things like reproductive health, which include, have you been pregnant, have you had an abortion or something like that, mental health, substance abuse, sexually transmitted infections, AIDS. Those are things that are stigmatizing, and because they're stigmatizing, or they may have some kind of effect on your social functioning, your social standing, then people are sensitive about that. And then maybe more so prior to the Affordable Care Act, but pre-existing conditions people didn't want people to know about because it might affect your ability to get health insurance. So but you want to hide that from people who unfortunately had access anyway. I mean, one of the problems with patients having control is that since most of us are covered by health insurance, when you go in for care, they have to be able, you sign away the rights to access to your information to your insurance company so that they can look at those data and decide how much to pay for your care. So we all want our care paid for, but you give up control of your information to the insurance companies and all the people that they can turn it over to. So control of access has been a problem. There are always security concerns. I mean, there are ability. Most systems have really high-grade ability to prevent hackers and people from getting into records. I mean, it's not that hard to do. We have the largest and oldest health information exchange in the country here. It goes back to 1987, and knock on wood, there hasn't been a single data breach. Okay, and so it's not that hard to control access. Actually, giving patients access causes more opportunity for lack of control than not, because you know, they could give their user ID and password to friends or their family members, saying, "Look this up for me," and all of a sudden that information is out there. Or they could use passwords that are 1, 2, 3, 4 or something like that that are easy to figure out. So, I mean, data security is always a concern, but the rules and the technologies available now, if used, are, in my view, adequate to prevent major breaches. Sure, there have been major breaches. I mean, you've heard about what happened in places where medical records have been hacked, but they're few and far between. I mean, considering the number of medical records that are out there, we haven't heard about many breaches. And the things where we've heard about breaches, interestingly, like the 80 million people who had their data hacked from Anthem, it wasn't their electronic health records. The additional security involved electronic health records resulted in protecting them from being hacked.